Hey there everyone, my name is Dr. Wiggy Saunders and I am a medical doctor that specializes in challenging weight loss cases. And in this video I want to talk to you about one of the reasons why Ozempic may not be working. So I use Ozempic a fair bit. I use all of the GLP-1 medications because they do seem to really help. They help with specific things like hunger and cravings, but they also do help to reset physiology. By controlling blood sugar levels and also by helping to reset leptin resistance. So I do like the medication, but I have seen in a percentage of patients, and I'd probably estimate that there's probably about a 25% case rate where there is some, let's call it Ozempic resistance, where it just doesn't seem to work. The main reason why that seems to happen, it is related to leptin. So leptin is kind of the key ingredient for that weight loss to either work or for it not to work. And so I monitor leptin levels while people are using Ozempic just to make sure, again, that weight loss is coming down, but also to ensure that it is doing what it should be doing. Now, what happens sometimes when leptin levels remain high, and this is after weeks to months of using the medication, this is where we will see some initial weight loss, but then we'll see that it gets stuck or that people start to plateau. And that is because of the leptin levels staying high and leptin resistance persisting. Now, one of the interesting things that I found that can cause this leptin resistance, which I don't think many doctors are looking for, it is a mold toxicity. So in some of these cases, after doing some more investigation and discussing more of the history, we find out that they live in a moldy environment, or that they work in an office building with potential mold exposure. After doing mold testing and finding that they have high mold levels and then treating for that mold, we see that leptin levels start to come down and we see that weight loss resumes again. And for a lot of people, this is the key thing to help the weight loss continue and for them to reach their weight loss goals. So if you're taking Ozempic and you're having some challenging weeks or months and the weight isn't coming down, you should ask the question, is there a possibility of mold exposure or mold toxicity? If there is, then I think doing some additional testing to see if that is the case, doing some treatment to clear that out, and I think you'll see that the weight loss starts to come down again. So that's it for today. If you want to follow me for more tips, I focus on weight loss, resistance, complicated obesity cases, and really helping people live their best life. Take care.